Today we'll start a rather important segment of this. We'll be talking about people being released from prison and the trauma that will accompany them most of their lives as a result of that. There's no question that those of you involved in public health, you're going to be dealing from time to time with families who have family members in prison or family members who have been released from prison. But that's always a very problematic domestic situation. And those of you who will be doing other kinds of work, because of the high incident of, or I should say incidents of persons in prison, those numbers continue to swell. There's no question that you will have some kind of relationship with them professionally. So we want to prepare ourselves for that eventuality. But right now we'll begin our discussion on prisons and the unseemly role that they play with respect to all of this. I should share with you that from 1974 until 1983, nearly 10 years, I served as a counselor for men who were incarcerated at the Albion Correctional Facility. That's when it was a male correctional facility. Now it's co-ed. There's women on one side and men on the other. And also at the Attica State Prison, both in New York. And my counseling purpose was helping to prepare them for their release back into society. At both the Albion Correctional Facility and the Attica State Prison, I was working with men who had a year or less to serve in incarceration before being released to come home. So my role was to help prepare them for the dynamics of that major step from prison back into society.
Stroke team, call the emergency department, critical care bay. Stroke team, call the emergency department, critical care bay.
Now there would surface, let me remember. I would go into Attica from 8 o'clock in the morning to 12 noon. That's after breakfast up to lunch. And that's every Friday morning. Albion was every Tuesday evening from, I think, 6 o'clock till about 9, about a 3-hour window there. But I did this for 9 years, better part of 9 years, meeting with these men, offering whatever I could by way of counseling and preparation. Now, there would always surface during counseling sessions personal difficulties and anxieties as these men contemplated coming home to situational dynamics and environments that were, in my opinion, less than engaging. Most all of these men were, we would categorize them as being very poor, with a low educational norm. Most understood, and this is what I was attempting to do. I was trying to be as frank and as honest as possible. No false pictures of signs saying, welcome home, somebody. It's not going to happen. Because most understood that release from prison did not equate with community forgiveness. And even though a person was no longer a prisoner of the state It did not mean that their debt to society has been paid, written off, or forgotten, because it had not. Even for those who would do a term of service in prison, what we call to the maximum. For example, sentenced to 10 to 7 to 10 years for a crime, and a person does 10, you would think that upon release, all the books would be wiped clean. No, they were not. Once in prison, your file, folder, your vet will follow you all the way to the grave. As the majority of these men were poor, many of them, while incarcerated, were plagued by a lack of public education, the lack of job skills. Most all had a very tough time communicating, and most all came from a weak family structure. That was not always the case. I remember one group that I counseled, one of the men was from a middle-class family whose father was a well-known pastor. But for the most part, a very weak family structure. In addition, most of the men in my counseling groups were always complaining. A lot of them complained about inadequate medical attention, while many others exhibited evidence for the crucial need of mental health intervention, which they never received. I'm saying men, I'm using that term because I had no experience counseling women, just men at both institutions. But men in prison with little or no support from family or community can easily lapse into helplessness, bitterness, and a rejection of and resistance to human relations, which many carry with them when they are released to society. And while incarcerated, if there is yet a living mother, that's a difference, she generally becomes representative of the strongest relational bond a prisoner might have. Most all of them talk about their mothers. Most will not talk about their fathers for whatever reason, but I did learn that a number of the men who were serving time, their fathers also were yet in prison or had done time in prison. I remember in one of my groups there was a young man from Buffalo. And every now and then we go around and talk about individually, one by one, things on their mind and whatnot. It happened that we were talking about fathers on one occasion. This young man said he grew up without a father. His mother was very responsible, that he violated her confidence in him when he turned to crime. But that in his later year, he was only in his, I'd say, mid-20s, but when he was a teenager, he used to look out the window where he lived, and there was always this man on the corner, very shabbily dressed, begging. And so one day he went out and the man approached him for something, and he didn't give him anything. He said that he was verbally abusive to the man, told him to get out of his face, that's all this and that. And then he told his mother about it. And his mother said, "That's your father." Wiped him out. And he hated his father. He hated him. Then he began to blame his father for his predicament. That was a very tough moment for me and for some of the other men who had not experienced that deep a cleavage in a relationship that they had or had with their fathers. But this young man stated, as far as he knew, he was still out there begging, and to make matters worse for him, his father didn't even know who he was. But his mother did. Now, the issues of prison and mental health. Now, these are some vexing interests. Even before I began to deal with mental health anxieties, these issues kept coming up. And due to a very insensitive prison administration system, some prisoners with mental health needs are routinely placed in the general prison population. They don't have anything specified for men with mental health issues. They are placed in what we call the general prison population, and in many instances, their mental health needs are ignored. And these men become subject to forms of abuse from other prisoners, and they also face deprivations as punishment. No TV, no this, no that, no visitors for periods of time. Many of these men are derided because of their behaviors, and they're called, at Attica they called them space cadets. The other men would call them space cadets. And there are other less flattering terms. Now, before you were born, about 25, 30 years ago, about 30, let's go back 30 years, there existed north of Syracuse a place called the Marcy, M-A-R-C-Y, Institution for the Criminally Insane. That term, criminally insane, that scares the bejabbers out of anybody. Well, they decided, Albany decided, New York State Legislature, that they would simply just decompose the institution. They did. And they've changed the name. It's something else now. I don't know what it is. But they took all the people who were in Marcy and sent them to other state prisons. Now, they sent 12 of these men to Attica. Guess who they asked to counsel them? Yeah. I said, okay, sure, I will. They're men. They're human beings. I'll do it. This was a strange group of guys. They had some old, really old guys. I was young then. I was in my 30s. They had guys in their 60s. They had one guy, now this was in 1983. They had one guy who was from New York City. He was arrested in 1951 for stealing a car. He'd been incarcerated 32 years for stealing a car. But they never let him out because they conjectured that something was wrong with him. I didn't get that. Now, here's another rub to it. every prison has at least 2 chaplains, a Catholic chaplain, a Protestant chaplain. And even though the number of Jewish people incarcerated is less, some institutions at least have a rabbi that they can contact in case there's a spiritual need. At least they claim that's what they do. But at Attica, they had both a Protestant chaplain and they had a Catholic priest who was chaplain. Now these guys from Marcy, who were Catholic, and Catholics who within the entire system, never saw the priest. He never visited them. He never had confession. He never gave Holy Communion. And so these guys were, why? Because they were criminals? Yes. But these poor fellows from Marcy, about, I don't know how many there were, maybe 5 or 6 who were Catholic. If you go a long period of time, if you're a Catholic, even if you're just a nominal Catholic, you want to have confession sometime. Get this weight off of you. And these men had never had a confession during their incarceration. They never had Holy Communion during incarceration. And they had never had a priest to visit them, to counsel them during their incarceration. The Protestant chaplain at Attica was just as bad. They didn't like him. They hated his guts. One prisoner told me that if there was another rebellion at Attica, the first one on the list to go would be him. They hated him. Simply because he took on the persona of a correctional officer rather than as a spiritual confidant. But these were things that happened because the guys who were mixed up, the guys who had been declared criminally insane to the point that they were placed in a very difficult institution for a number of years, they and others were not getting the spiritual needs that they really deserved. So if you're a Catholic and you are withheld from confession or receiving the sacraments, that will only add to your mental confusion badly. If you are not a Catholic, if you are a person that has come through the church to get less than spiritual counseling at a time when you need spiritual counseling, that is a very, very bad thing. One thing that these prisons did offer that I did agree to do for a while, but I soon stopped because I recognized that what we have going here was something that wasn't quite right, and that was marriages. They did permit inmates to marry, but a lot of these guys are very slick. A lot of these guys know what words to use to a lonely woman who is part of some kind of prison visitation team, like the churches that go in periodically. They know how to do that. And once married, that gives them a better opportunity to be released. But once released, that marriage, for the most part, just doesn't work at all. Yes?
I just wanted to add to some of the things you were saying about like the changes at Marcy, because my dad actually ran that facility about 10 years ago for 5
Which
years.
facility?
Marcy.
Uh-huh. Oh, yes.
Yeah, so a lot's changed because of the issues, obviously, and like how like poorly it was structured and the effects it had on like where inmates were going, and the fact that they would just be like either not cared for, or like if they were released, then they would just return because they like committed a worse crime. And they've actually had really good outcomes with the, I think it was about 8 years ago, how they changed like the whole structure of the facility, and how like all the state prisons, like when they were, like after they did send them out, like now like they are getting sent there specifically because of the program. And also with like what's offered like religiously, I know that all of New York State prisons have like an interfaith like chaplain. I don't know if that's the correct term, but they usually have one who's Christian and one who's like interfaith, and then contact to whatever like religious like leader if there's anyone specifically. So my dad has said like religious like support has like increased so much, and the inmates really do like create a good bond because they've made like such an effort in New York State to change that, to improve their mental health. Obviously there's a lot of room for improvement and problems with the system as a whole, but as far as like what New York State has done, like a lot's changed in like the last 10 years.
And this is about 8 years ago?
Yeah, I think Marcy was like restructured, and they definitely.
What is it now generally?
I'm trying to think of the exact title, but it definitely is like a mental health facility. They call it like the mental health unit.
Mm-hmm.
So yeah.
Yeah, in the old days, going back 25, 30 years, Marcy was, people were just paranoid because of its presence, criminally insane. That's what they're called, the institution for the criminally insane. That carries all kinds of false vibrations with respect to that. But thank you for that information. That's very, very helpful and very, very useful. I want you all to remember these things because you don't know what kind of situations you might be placed in if indeed part of your career will be working with persons or with families under that kind of designation. Yes?
One of the things that our prison and jail facilities are known for is like if somebody has a mental health need, instead of like getting them psychiatric help, they just like put them in the shoe. Like they just say like go be isolated. They have my cousin. He's doing an 8-year bid, and he had psychiatric help in the past. Like he's got a lot of mental issues that if they're left untreated, he like has a lot of anger problems. And so instead of like, and he told them this going in, like I'm on this medicine, this is the doctor I see, is there some, are my services gonna be like transferred? And they were like, we're gonna, yeah, like don't worry about it. Well, they never ended up giving him psychiatric help. So then I think out of the 7 or 8 years that he was there, he spent like 4 of them in the shoe. Like they just isolated him instead of just giving him help. And then it got to the point where every time he got out, he would purposely just go back because he didn't want to deal with the people. So he was like, just give me the rest of my sentence in the shoe. But when he got out, it was just like really hard for him to communicate because he really hadn't talked to anyone in like so long.
Yeah, that's a major problem.
Because it wasn't just like a 3 or 4 month thing, like this was years that he was just like isolated. And like he would come out for a week and then they would just put him back. And it got to the point where it's like something that someone else would get a warning for, they would just automatically put him in the shoe. And it was like, those were major problems where that could have all been avoided had they just offered him the medication and psychiatric help that he needed.
Yeah, that's tough. That's really tough. And this thing about doing something intentionally to be returned to prison also has its rootage in the fact that most prisoners consider each other as family, and these are the only people that they relate to. That's why nothing really changes too much. When you're in the military, once you get out and go home, you find yourself for months talking military talk that people don't quite understand. You have to kind of catch yourself on what you're saying to make sure that what you say is understood. Same thing with, you mentioned the term bid. That's a term that they always use when they are sent to prison. I'm doing a bid of thus and thus. But I learned to adapt to the language because it was new. I had to ask what they meant. And once I learned what it meant, I could simply communicate better. But this lack of communication is a very tough issue, and it goes to show that there was much of a deficit with respect to people from the community, people from family, people from the spiritual responsibilities that are supposedly there. There's a deficit in that kind of contact, a major one. So we find that people who are incarcerated who have major mental health issues, the chances are that they will go through their entire bid without being able to get the kind of help that they need. I've learned, I used to meet with the psychiatrist that, the psychiatrist is one psychiatrist and an assistant assigned to every prison. I used to meet with the psychiatrist at Attica. I think he was a good fellow, but he was always very, very frustrated in that the things that he would recommend to the prison that mentally distressed prisoners needed were just never taken seriously. Simply because those who watch care prisoners, to them, they're watch caring criminals, bad people. And if they have a truly physical or mental health situation, that's their problem. They're not there to tend to that. They're there to confine them with respect to the crimes that they have committed. So that's one instance that really has to be dealt with. One of the things I'm going to do, and I saw a hand, one of the things that I'm going to do, let's hope. I have a man coming in, but he works with prisoners after their release. I know two guys in the community who have retired from prison chaplaincy. I'm going to try to get one of them to come in to talk about this thing as well. Probably when we come, oh yeah, no, it has to be when we come back from break, but we can anticipate that. Yes?
I think one of the biggest barriers to the prison population getting the help that they need is the lack of the medical and the mental health professional community just doesn't take their problems seriously, and that's something that I've seen when I, in my EMT experience, because I had more than several calls in the Monroe County Jail, right on or off of South Plymouth Avenue, and my patients, the inmates, I guess, would be having, I think all of the ones that I treated were actually having serious problems. Like, I think one of them was having like an asthma attack, and he had been like intubated 12 times for really, really severe breathing problems. And another one was like coughing up blood, like these people were actually sick.
Yep.
But the prison staff, my colleagues, the doctors in the ER, the nurses, they were very skeptical. They were like, oh, it's incarceritis. I don't want to be in jail-itis, making comments like that. And that is a huge hindrance to the people getting the help that they actually really need.
You mentioned that a large number of people who are incarcerated who are legitimately ill, either physically or mentally, they're constituted as being malingerers, that's all. People who fake illnesses. But many prison investigations over the past 10 years have been dealing with people who have died while incarcerated, either through suicide, but mostly through medical terms. At Attica, there was the family won a lot of money because this man actually had a heart condition. He kept complaining. He had pains in his chest. He needed medication. They came to his cell one morning. He was dead, and he died of a heart malfunction. But this is very consistent in prisons. And one of the and I don't know if anybody around here is from New York City, but Rikers prison on Rikers Island, they had so many, they almost closed it down. They had so many infractions in terms of health, in terms of mental health, in terms of cleanliness, sanitation, rape, a lot of stuff that they had to really clean up and get rid of a large number of people who had positions of authority in the prison. We run into corruptness in prisons everywhere. We run into people who, correction guards or COs as they're called, to the aside, but people in administration who can make the changes in prisons, they don't do that. It's just like a job. They come in, and many of them never are a part of the general prison population. They don't see them, they just sit around and they come up with stuff to do. But it's bad. It's not good at all. And a lot of people carry whatever illness that they have. When they're released, they just carry it home. That's all. That's all they do.
Do you think that at the bottom of that is like this attitude that people have that prisoners are, because of what they've
Yeah.
allegedly done, are like less than human, like they don't deserve to be treated, you know, on the same level as, you know, non criminals?
Yeah,
Does
and they're
that-
not treated in that correct way. The best way to treat a criminal or a person, let's just say an ex-felon, best way to treat them is with normalcy. All right, we know that you've been to prison. That's in the past. Let's start from here. You want a job? Yeah, they'll say yes. Get them a job. I had one instance, just one, but it's glaring. There must be many more. I had one instance of a young man who was on parole, and we were working to try to get him a position because he was a nice fellow, nice kid. And we got him a job at St. John Fisher because he had experience as a landscaper, and he worked with the maintenance department, tending to the lawn and all this other business on campus. Whoa. When you're on parole, the first thing you're to do in a job interview, if the question is asked, if it's not asked, don't volunteer. If the question is asked, do you have a prison background? You've been to prison? Usually it's on the application. And if you say yes, then they have to deal with that appropriately. But don't say no if the answer should be yes. Because generally, if it's found out, you're axed from your job. And this is what happened. This young man was working, his supervisor liked him very, very much. He gained the confidence of the men that they worked with at St. John Fisher. But one day, his parole officer knew that's where he was working. So one day the parole officer just drove out, which they have a right to do. Anytime they can show up. And he asked, do you have so-and-so working here? And I said, yes. And he said, well, I'm his parole officer. May I see him, please? After he saw him, he was called into the office of St. John Fisher College, a very strong Catholic institution that supposedly practices the sacrament of forgiveness. He was fired on the spot. Then, you know what he did? He recidivated. We got that information that he had gone back into crime. But the thing is, to tell the truth, tell the truth. If you work with people like that, encourage them, insist that they answer every question correctly, because they'll get off much better. And I saw a hand. Yes.
Well, I know there've been a lot of movements, at least try to legally get rid of that box that people have to check to say whether they've been in prison or not.
Are you familiar with that movement?
Yeah.
Yeah. What's it called? In the Box or something?
Yeah, I think it's in the box.
Yeah.
I'm from Massachusetts, and we have
Tell
a
us
lot
about
of
it
things.
more now.
Well, I don't know like that much, but I mean, it's just that if you have that question, I mean, it's opening up this opportunity for a lot of discrimination, that whether it's conscious or not, these people are going to be discriminated against for, you know, whatever they committed, and they're being required to volunteer this information. And like you said, if they, you know, don't say it correctly, they're going to be fired for that. So it's not information that an employer necessarily needs, and it's preventing a lot of people, even just from the beginning. So to like even get an interview, because if someone sees that they check that box, then they'll have to explain why, and then it's like a bad
Yeah, it's very intimidating. I have seen some applicants that, or have you ever been convicted of a crime? I think that if you put yes, they'll say, or the next question is, what kind of crime? Did you do time? I mean, it really gets personal. And so this movement, if I'm correct, I've been in one meeting where this group, I think they're out of the Judicial Process Commission, that they have started a movement called Ban the Box.
Yeah.
That's what it's called. Ban the Box. Attempting to have eliminated from all applications any questions that would refer to a criminal background. they're saying that it's unjust, it's unfair, and it's prejudicial. And it certainly is. Certainly is. So I'm glad you raised that. Thank you. Yes.
I just wanted to say this is from like a little while ago, but I was thinking, so like there is like an inmate advocacy group like out of Albany that goes to each prison and like evaluates their mental health services and like how all their paperwork's done, and like making sure that like inmates who do either like request their own like care, or if a like correction officer like recommends that for them, or like whenever they're in a conflict with another inmate, like they have to be like counseled and evaluated. But I think like something that's missing, like even though they come in and evaluate like the paperwork to make sure like things are done properly, and they evaluate like the types of like services to make sure they have like counseling like before they exit, and as far as like different opportunities like within groups to I guess like whatever their like needs and or like interests are, like they do have like programs, they call them, there's like a variety of programs they can participate in. But I think like definitely something that's missing that would prevent like some of these issues that come up later in like an inmate sentence is having like stronger support like when they enter the prison system to like build some trust, so inmates know that they like what's available to them, and that like if they have like a health concern that they're like going to receive care. Because like my dad has brought up how like they do have like the medical staff and like at the hospital, and like when they have to take them off site, like there is like that attitude of like they're just trying to get like a ride out of the jail for like a little while, but that's not the majority of the cases. And like for like the ones like that does happen to, like that's very expensive, and that could be prevented if there was like more trust built in the beginning. As far as like, it's like terrible to think you want to get someone acclimated to prison and they're comfortable there, because like that's a terrible thought, especially when like sometimes like that's not where they should be anyways. But as far as like making sure like they know how to get like the help they need, especially when they're having a conflict, instead of like they have a conflict and then they're like thrown into like the box for like a week or whatever, like making sure that like, okay, this is how you handle this situation, like if you do this it leads to that, or like if you have this mental health concern, or if you observe another inmate having this like issue, like this is how like the exact way to like handle it, and just kind of like building that trust a little bit. Because like I know just by like some of the stories my dad has said, and like running into his coworkers, like he's gone like above and beyond to make sure like they're like providing like above like the current standard of like mental health services. Because like if he didn't care, then like easily you could have like the administration not caring for like the mental health needs of the inmates, which you do see a lot of places. So you definitely need staff that genuinely cares, because like I know like my dad does, like administration, like they do have contact because they have to do a certain number of like rounds each week where they like tour the whole facility and like check on like performance of like different areas of staff like at different times. So they do have contact, but it's unfortunate that because like everything's coming from Albany at this time, like they can't make changes they would like to make, like no matter what they see coming up like in their facility, like they can't respond to the needs because like a lot of it's legislated in Albany.
Yeah. Perhaps one of the most frustrated set of people that we have within the prison system are persons who are administrators, who see the corruption, who know the abuse, and who try to set different standards, but they can't, simply because they're withstood with respect to most of these. For example, the educational system. Ooh, it's terrible now. They used to offer, I can't even remember who the governor was before Cuomo now. It's been so long. He's been in office for so long. I had to chisel him out. But there was, and I saw the hand, so I'm getting to you. There was a time when you could take what they call extension courses, college extension courses. They stopped all of that. And one of the reasons why they stopped it, I understand why they stopped it. They stopped them because there was no concrete evidence given anywhere that the colleges that they were involved with, long distance extension courses, actually legitimized what they had learned upon their release, attempting to gain, pardon me, entry into these schools. And they were not permitted entry because of the fact of their background. So why have these extension programs if indeed the majority of the schools are not going to honor them? I say let them have the programs anyway because it still benefit them. I've seen persons actually learn how to read as a result of some of these things. How to do things, how to communicate. That's a major issue. Verbal communication. I've seen substantive letters from individual prisoners that I received. I've seen those letters change over a year or 2 years of their writing letters. Now it's written in a way that is objective, written in a way that is comprehensible, written in a way that is less bitter, less even self-incriminating. A letter. And this is very, very good for them to know. Take that away, and it even adds more to their detriment as prisoners of the state. They have programs. They have air-conditioned programs. They have computer programs. They have some programs that exist within the context of prison. Some of those programs have been eliminated and annihilated, but some still there, and you can use them. You can use them because every skill you get, if you earnestly seek to get a skill, can be utilized in some way once you get out. I'm going to tell you this, that there will always be employers who will take a chance. Take a chance. But in many instances, taking a chance with an ex-felon will result in that employer ending that relationship because of the failure of an ex-felon to do the correct thing. We had a guy we sent to a northern packing company who stole one of the trucks, and that ended the relationship because that was a good job for guys to come out of prison, work, and you start at the bottom, but you're secure, you're working. If you have a family that puts some money into the home, but you have to be very, very careful with that. Like the St. John Fisher incident, that was terrible because the young man really did need a job. Who are the hands? Miss Weaver and none others on that side, and Mrs. Atkins. All right, Miss Weaver.
One thing, just to go off your comment about like dehumanizing them and really not giving them the proper medical attention that they need.
Yeah.
So when my dad was doing his time in the county jail, he has diabetes, right? So that's not like a made-up disease. And he's insulin dependent, and they were not giving him his medicine or a special diet. Like, they were still giving him, like,
Yes.
all the food that he can't eat. So my dad, being very crafty, would trade his brownie for other people's, like, vegetables that they didn't eat because he knew he couldn't eat it and they weren't giving him insulin. But they also weren't, something happened, I think they had, like, bugs or something, and they wouldn't let any of the inmates have food in their cell, like, while they were cleaning the facility. So my dad would get, like, low glucose levels, and they weren't letting him have food, like, at night. So my aunt's wife, by chance, she's a nurse, she got transferred from the hospital to the jail, and she realized, like, that my dad was not receiving any insulin, and she was, really close to the family, and she had to go to the head person, like, and advocate for my dad. Like, he's an actual person, like, this is a medical condition. And then he started receiving the care that he needed. But what if she didn't what if she wasn't transferred by chance over there, you know? And she really started advocating for all the inmates who like had these medical problems and were like going unseen, like, cause he was only there for like a month and he had already been in the hospital 12 times because of his diabetes, and they were not giving him like insulin. So then when he got out, his nickname was Weaver Medical because he got called down before and after every meal. So sometimes we'll still get letters at the house. It says, Weaver Medical, how are you? But yeah, it was just like amazing to me that it wasn't just like something that was unseen. Like diabetes is like a really serious disease that's easily manageable, and they were just completely neglecting that because they didn't see him as a person.
That is correct. Now, before Mrs. Atkins, let me say this. That's been challenged across the board. Muslims who are in prison have challenged the system that they have certain dietary laws that they have to follow. The state legislature approved their requests, and now Muslims have to be given at certain times of the year, like Ramadan or something, certain foods that they are required to have, but never are they to eat pork. And so that was the toughest thing they got through. That's number one. Number two, Jamaicans who were in prison in this country, most of them are claimed to be Rastafarians. So they are asking that they be permitted to grow their dreadlocks, and also that they be able to practice Rastafarianism whenever possible in prison. The state legislature voted in their favor so that they can enjoy their cultural nuances whenever it's felt to be to their best advantage. Got to keep the prison population contented. People remember Attica. They remember that explosion that occurred because of prisoners' rights being dismantled. Now, another thing, who's JPC? Another thing that the JPC did that was very, very good, there used to be this problem of family visitation. At one time, the majority of the prisoners in Attica were not from Monroe County, they were from far away. Many of them were from New York, but people would come down. If they could make it to Rochester, JPC would have a bus for them free to go all the way to Attica to see their loved one. But they had no place to stay. And many times they would come and they'd only have about an hour, and then they'd have to leave, go back, because the next visiting time would be 3 or 4 days away. So what JPC did, I've forgotten the name of the program, but they arranged for families who were coming from New York to come a day ahead so they'd have a place to spend the night and have that much more time with their loved one. So there's a lot of impracticalities, but if you can challenge them, and sickness, diabetes is such a horrible disease, and it can take you out of here. And if you can prove that you were discriminated against medically, that you did not get the medication that you are supposed to have received, then you can win a lot of money. A lot of money, simply because they just can't do that. You can't do that. I don't care what a person has done. You can't restrict them from getting the medication that they need. Unfortunately, the psychiatrists at these institutions are either institutionalized, or if they're not, like the man that I knew at Attica, whatever they suggest or recommend for change, for help toward those that are mentally distressed, they don't get it, or they get just a piecemeal of it. They don't get it. So we have a long way to go with respect to the prison system.
I was going to comment about your statement about the way of the interaction, but if you look at most prisons, they're located in rural areas.
Rural areas, villages.
Yeah, that don't have, have a minimal population of minority folks that they interact with. Also, the prison guards, for the most part, most of them have just barely gotten a high school diploma, have no interaction. The system automatically, when people are incarcerated, will send people from New York City to Attica, to Groveland, up north by the Canadian border. So, and it makes it very difficult for poor families to visit or understand or know what's going on with their loved ones. And so what happens is, the mentality is, I believe the media hype, I believe what I see in movies about blacks, Hispanics, Native Americans, anybody that's not like me, and so I just treat you in a way that's how you need to be treated. And so it becomes, in their mind, it becomes a self-fulfilling prophecy. Well, see, they do have to be incarcerated, and they do have to be here. When you talk about all the improvements, and New York State, I think, has led the way in terms of trying to improve access to mental health services, to medical services, for changing the way some things have been done. But it all comes down to the almighty dollar and the budget. These people have committed a crime, they need to do the time. And, you know, it's a budgetary issue, and it's just not gonna happen. And so now you get to the place where today, they're moving more toward the privatization. I don't think it'll happen in New York State, but the privatization of prison systems. And so, you know, it just shudder to think what will happen if this takes hold, because all of these systems of abuse and corruption will just absolutely continue because they're out of the scope of, you know, any kind of oversight or authority. And then the other thing is, like you were saying, there is the prison advocacy group, but the other piece is prisoners. My youngest son was incarcerated, and so the thing is, the inmates do stick together. There is somebody when you go in, you know, an older guy told him, read your rights, read the manual, understand it, know that, make that your Bible, understand that it comes. They have to do what, you know, they've written here. The other piece that happens is that families need to understand if something's not going right and you have a family member that's in a prison that's not abiding by the book, you call Albany. You don't deal with them, because the worst thing they want is to have Albany call the prison and say, we got a complaint from the family, because they will investigate that. But again, you're dealing with people that are already marginalized, already don't have any kind of contact with authority, don't know how to navigate systems, and so it's easy to perpetuate the abuse and the corruption that goes on.
Yes, thank you. Now, we need to know that this privatization of prisons, that's on the new president's agenda. He strongly supports it, as does Mr. Sessions, who is the new Attorney General. So we can expect some conflagration on that as times come. The other thing is that you're absolutely right. And one of the reasons that these prisons are placed in remote areas, just as she has indicated, Mrs. Atkins, but they also represent the highest form of economy in these towns or villages where they're at. Means employment. Most of the people who work as COs in most of these areas are from these towns, these villages. They also uncovered several years ago at Auburn State Prison, one of the larger state prisons, penitentiaries that we have, uncovered a Ku Klux Klan chapter that was started by one of the COs. Now, they did not do too much to him for that. They just indicated that it's okay if he's a member of the Klan, as long as he did not teach or emphasize Klan activity among others in the prison. And as long as he didn't practice the kind of abuses that would be validated by Klan membership on prisoners. And that was less than a slap on the wrist. He should have lost his job, but that did not occur.
Wait. So they said it's okay that you're a member of a hate group.
Yes. Well, and yeah, that was
I'm
before
sorry.
that.
Yeah.
That was before that occurred, all of the hate group syndromes now.
But also legally, they could, like, he would be able to sue for discrimination if they fired him just because of that. Like, I'm not saying it's okay, but, like, that's how it would work.
They can't tell him, they can't, like, flat out
Yeah.
tell him, you can't be a member of a certain organization.
Yeah, like, he has that freedom.
Yeah, now they have this poverty
Garbage, but it's.
organization in Atlanta that keeps a kind of like a watchdog on all of the states with respect to terrorist activities, white supremacist activities, terrorist activities. And one of the things that they zeroed in on right away, and this of course was some years back, the Klan thing, one of the things that they have been successful in doing is rooting out these organizations that do exist on prisons. Now they have a new venue, it's the college campuses, because they got a lot of this stuff that's being experience on college campuses, but for the most part, prisons were a perfect way in which to satisfy, whether you were a member of a hate group or not, to satisfy your sadistic urgings to mistreat people. That's in the past. Well, let's keep going. We don't have but a few more minutes.
Could I just add one other thing? The
Yes.
other thing that's happening, I think, within the prison systems, I think nationwide, are the increase in gangs. I mean, you always had kind of sects. You always had, I would say, the black Muslims. You always had, blacks probably congregated with blacks and whites with whites. But now you're having gangs, and the gangs fulfill a need for the younger people that are coming in, that are feeling like they, never had a chance, never had a shot, and so they bring them in, and so gangs are now on the rise, membership in gangs, and
There's some homicide that we
Yeah.
can expect in
Right.
these prisons. Most of are gang related.
related.
The explosion of gangs in prisons paramount in states like Colorado and California. I mean, you have Latino gangs, you have African American gangs, you have white gangs, and very, very seldom do you read or learn about them working together on any issue that's paramount for all those prisoners. They usually are self-interest groups, and they are in opposition one to another very strongly. But that's something that I'm sure if we could get a chaplain, a retired chaplain, that he would talk about. Let's pray that that's the case. But let's continue for a few minutes. Now, the trauma and violence of prison life can become critical to the emotional and psychological well-being of a prisoner once released from bondage, prison. Similar to the adjustment difficulties experienced by returning combat veterans, ex-offenders are beset with post-traumatic stress disorders, making domestic readjustment problematic, and in some situations virtually impossible. In the majority of circumstances, let's say since 1970, the brunt of American prisons have been filled with poor, undereducated Black and Hispanic men, many victimized by drugs and the propensity of crime and violence in their own communities. And since 1980, we need to really take stock of this. The rise of female incarcerants. Well, to me, this poses an imposing situation, as many of these women represent broken family bonds and relationships. Many of them have children, and as most of them will be of childbearing age upon their release from prison, childbearing age raises the spectra of the pandemic quality of HIV/AIDS relative to possible marriage, unstable intimate relationships, and the bearing of children. Many of these children are born in prison. It's a major problem. Now, this is where we'll stop for this morning. Sadly, there has not been a strong improvement of prisons nor of the criminal justice system since the Attica explosion in 1971. Has not been. For the most part, prisons are stock houses for human beings, trapped in repressive and oppressive institutions which do not reform its inhabitants nor encourage their penitence. And once released, the vexing issues surrounding readjustment because of race, poverty, and mental health continue to endure. Auburn State Prison. It used to be Auburn State Penitentiary. They do not refer to prisons as penitentiaries any longer. The term penitentiary meant an institution that would strive to reform. The term is from the term penance, or your ability to look in yourself and say, I have done wrong. But that is not the case. None of the prisons qualify as penitentiaries simply because prisoners or inmates are not required to practice penance. So they come back pretty much with the same attitude that they had when they went in. And during the strain of the recent presidential election, Mr. Trump and Mrs. Clinton, and through all of the presidential debates that we have had since July of 2015, poverty nor prisons was debated, discussed, or posited as issues of cruciality. Since then, Mr. Trump has said that he supports the privatization of prisons. So does Mr. Sessions. We talked about that. It was not a campaign item. Mental health statistics in America receive basically the same lack of attention from candidates and media. So we can ask the question as we wait till next Monday, what does this bode? What does this bode for our country in the future? We need to have the kind of institutionalization that can head off negative behavior. Much of this will depend upon what happens post-incarceration. We're going. But one of the things that I used to really talk to guys about is forming a new peer group. You got to do that. You got to start going to places that are positive and not negative. Stay out of nightclubs. Stop doing those things that you used to do that got you in trouble. Create a new peer group. Go to church. Meet people who are positive. And if you're not married, if you're going to fall in love with a woman who is going to be beneficial to your life. But be sure you fall in love, that you're not a trickster. You're tired of tricksters. Every marriage that I've done that I can remember relative to prisoner, community person, after a while, after release, the marriage goes up in smoke. That's all over, that's what it was for. I got a home when I got out. I'll have some sex when I get out. I don't have to work for it. I have somebody cook for me, to do this, to do that, while I go and do other things that I like to do. And that's the general idea behind marriage. But that's my experience. Others might have had a different experience, so we'll put that one in a box. But be mindful. Any final questions? Yes.
Something that I think is of importance,
Mm-hmm.
that I guess maybe we'll go back to later is and it kind of ties into what you mentioned about the gangs, the widespread saturation of prisons with drugs.
Oh yes, easy.
And
Very easy.
I guess my cousin was incarcerated several times. He did several stints in prison for drug offenses, and it seemed like after each time, he went twice, it was worse. Like they didn't rehabilitate him. There was no rehab that took place.
Mm-hmm.
If anything, each time he got more and more involved in that, and he failed to, like, I mean, obviously, like, I don't know his entire situation because, like, it's not really something that, like, we talk about in my family, I think, because there's so much, like, stigma around it, or, you know, and also because my dad and his brother, they're not close, but, and my uncle is he didn't get reelected, but he's the district attorney of Portland County. He was in the news a while back because he had a scandal where he lied about being a porn star, and then that came out when he got reelected. So sorry, I just think it's kind of funny. But it's he tried to get my cousin off for his drug offenses. But then that was also like a scandal, so he couldn't really do that. So he went to prison. He came out. He tried to get a job. He couldn't get a job. He tried to go to community college. That was something my uncle kind of pushed him to do. He dropped out. You know, he barely finished high school in prison. He had a job for a little while. He was working in a factory because he got some kind of training. But then he got back into drugs. He went to prison again, and eventually he died of a heroin overdose. So there was no, and I think unfortunately that story, that life path, that's not uncommon.
It's duplicated
Yeah.
across the country. Now, one of the things, before we go for sure this time, but one of the things that I just didn't believe at first, I could not believe that people who had drug problems could satisfy mostly those same habits while in prison. And it really took me a long time to reconcile the fact that some of these prison guards are actually coming to work with drugs to give to these guys. You know, I said, what? What? I know there was a time when people were putting drugs in cakes, putting drugs in things they were giving to, we'll talk about that somewhat when we come back, but yeah, it's amazing what can happen. It's a society within a society and a world with its own complexities.
Response, Maid Hospital.